This is a short video that explains what is meant by chemoprevention and discusses the implications for women who carry BRCA gene mutation. Chemoprevention is the word that we use to describe using drugs to reduce the risk of cancer occurring. In 2017, the National Institute of Clinical Excellence recommended that chemoprevention could be offered to women who were at increased risk of breast cancer because of their family history of the disease. There were 3 drugs that they recommended, and these included tamoxifen and anastrozole, that are commonly used to treat breast cancer. They are only useful in treating estrogen receptor positive breast cancer, in other words, cancer that is sensitive or needs estrogen to thrive. These guidelines were developed on research that looked at a large number of women who had a family history of breast cancer. And within these studies, there would have been women who are carrying BRCA1 and BRCA2 gene mutations, but they may not have been aware of this at the time. But what we need to consider is chemoprevention a useful alternative way of reducing the risk in women who carry BRCA gene mutations? We know that women who have BRCA1 or BRCA2 gene mutations who develop ER-positive breast cancer, that tamoxifen is not only useful in helping to reduce the risk of the disease spreading, but also reduce the risk of them developing a second breast cancer in the other breast by up to 50%. The studies have shown that for women who have not had breast cancer, that tamoxifen given for 5 years will reduce the risk of them getting ER-positive breast cancer by at least a third, and that this reduction in risk extends for longer than the 5 years that they're on treatment and may extend to give them some level of protection for 10 and maybe 15 years. Further studies then showed that anastrozole also helped to reduce the risk of women getting breast cancer, and in fact the reduction in risk seemed to be even higher at 50%. I've mentioned that these drugs are only suitable for reducing the risk of ER-positive breast cancer. So we need to look at the type of breast cancers that women with BRCA gene mutations are more likely to get. And it is different between BRCA1 and BRCA2. For ladies who have BRCA1 gene mutations, 70% of the tumours are what we call triple negative. This means they don't have receptors on the tumour cells for estrogen, progesterone or HER2. And taking tamoxifen or anastrozole will not reduce these cancers. Only 20 to 30% of cancers that occur in women with BRCA1 mutations are sensitive to estrogen. The picture is the complete opposite in BRCA2, where 70% of the tumours are estrogen receptor positive and only 20% of the tumours are triple negative. This means that chemoprevention cannot be recommended for women with BRCA1 gene mutations. But let's think about the women with BRCA2 mutations. I quite often met women who had been diagnosed with breast cancer in their early 50s once they'd started breast screening. And perhaps because they had a family history, they then proceeded to have genetic testing and were shown to carry a BRCA2 gene mutation. These ladies had already had their breast conserving surgery, radiotherapy, and were commenced on tamoxifen or arimidex. So as well as reducing the risk of further disease, they knew that the drugs they were taking would help to reduce the chance of them getting a further cancer. Quite often nowadays, we would recommend taking hormone treatment for up to 10 years. So this is an alternative for these women, especially as they're going to continue to have regular screening with mammograms on a yearly basis. And for some women, continuing to take their hormone treatment in the form of tamoxifen or anastrozole gives them an alternative rather than having to make the decision to have further surgery to remove both breasts. Some women decide that they don't want to have risk-reducing breast surgery, and if they're over 35 and there are no other contraindications, then chemoprevention is something that they may wish to consider. Some women are not suitable for risk-reducing surgery. Maybe they have other health problems and therefore the risks of the general anaesthetic are too great. Women with large, heavy breasts may be concerned about the outcomes with breast reconstruction and yet don't want to be left flat-chested. And certainly chemoprevention is something that they should discuss in greater detail with their doctor. There are some women who have got other demands on their time and other priorities in their life. If they're caring for a disabled child or a disabled or ill partner, they may decide that now the time is not right for them to have major surgery. And chemoprevention may be a very suitable way of helping to manage their risk of breast cancer. It's always very hard to decide when is the right time to have risk-reducing surgery. And with BRCA2 gene mutations, the risk of getting breast cancer really starts to increase really into the later 40s and early 50s. So perhaps a woman in her early 40s has decided that now is not the right time for her to have major surgery. She carries a BRCA2 gene mutation and she's not going to have surgery for at least another 5 years. So perhaps she would want to consider chemoprevention as a way of reducing her risk of breast cancer for the next 5 to 10 years. Tamoxifen is the only drug that is suitable for women who are premenopausal, and it does have some side effects. The side effects vary enormously from one woman to another, and most commonly include menopausal symptoms. With tamoxifen, we also must be aware of the increased risk of blood clots and of endometrial cancer, that's cancer of the lining of the womb. But an opositive tamoxifen is known to strengthen bones by increasing and preserving bone density. Anastrozole is a drug that is suitable just for postmenopausal women, and again can be associated with menopausal symptoms, but also some women will have achiness and stiffness in their hands and feet. Anastrozole is known to increase the risk of osteoporosis. So if a woman is considering taking anastrozole as a form of chemoprevention, it would be important to discuss with her doctor whether or not he would recommend her having a bone density scan to look at her bone density before starting treatment. I hope that you have found this short presentation useful. And if you have any questions, please leave them in the comments below. And if you have any suggestions for any other questions that you would like me to look at and answer, I would love to hear from you. Also remember that you can visit the website www.brcapositive.co.uk. This site has only recently been developed by myself, and there's still a few things that need to be sorted with it, but the majority of the information is already there. Goodbye.